In this video, I will explain the indication for dialysis. All of these indications will be helpful in different clinical periods related to USMLE, PLAB and MRCP exams, and especially in your clinical rotations of nephrology and critical care unit. So we will start our today's video. So the first thing to remember is this mnemonic of A, E, I, O, U. Each of these alphabet will represent one indication, so it will become easy for you because all of you know this sequence of alphabet. These are vowels, and so the first one is A for acidosis. By acidosis, I mean metabolic acidosis, and which is not responding to medical therapy. For example, if there's a patient, he or she is having metabolic acidosis as evident by ABGs, and for example, the pH is 7 or 6.9, and the patient is not responding to medical therapy, so the patient should undergo urgent dialysis. So after that comes electrolyte abnormalities, and which electrolyte? It is potassium. So symptomatic hyperkalemia is one of the most important and urgent indication for dialysis. And how will the patient present you? The patient could have a ventricular arrhythmia, or he or she could have ECG changes. And what are those ECG changes? These are peak T waves, flattened P wave, prolonged PR interval, ST depression, or prolonged QRS duration. We will have a separate video in which I will explain different types of ECG anomalies, ECG abnormalities, of ventricular arrhythmias, of paroxysmal ventricular tachycardia, and multiple arrhythmias, but it will come in the next lecture. So in this video I will just give you, I have just written the short words so that you should remember, and most of you would be um, um, most of you would know what are these ECG changes, but we will have a separate lecture for that. And the second one is severe hyperkalemia. And what by severe hyperkalemia I mean potassium level of greater than 6.5. So, and which is refractory to medical therapy. For example, the patient has a potassium level of 6.8 or 7, and after giving insulin or beta 2 selective beta 2 agonist, and the patient has still potassium level of greater than 6.5, then he or she should urgently go dialysis, hemodialysis for that. So after that comes ingestion, and by ingestion I mean ingestion of toxins or drugs. So toxic alcohols, that is methanol, ethylene glycol, salicylates, lithium, sodium valproate or carbamazepine, barbiturates, isoniazid, theophylline, metformin. So these are some drugs and toxins which, when given in toxic doses, and so the patient should go dialysis for the urgent removal of these toxic uh, metabolites from the body. So after that comes O for overload, and U for uremia. So we will discuss these two now. So the first one is the fourth one is overload, and by overload I mean fluid overload. So if, for example, if a patient of having chronic kidney disease or any other disease, and the patient is having symptoms of fluid overload, for example, raised GPP pressure, or um, um, pleural pulmonary edema, and the patient is given diuretics, and still the patient is not responding to it, so then he or she should go urgent dialysis, so that the volume overload should be decreased. After that comes uremia, and uremia. So most of the sometimes the patient have increased blood urea levels, but the patients are not symptomatic. So this is not an indication for dialysis. But if the say uremia become symptomatic, and what are those symptoms? Say encephalopathy, pericarditis, bleeding, pruritus, fatigue, or anorexia. So if the patient has if a uremic patient has any one of these symptoms, then it's an urgent indication for dialysis. In encephalopathy, the patient would have altered mental status. In pericarditis, the patient would have a pleural rub on cardiac auscultation. The patient could have bleeding for episode, for example, melena, hematemesis, or epistaxis, because increased urea levels cause dysfunctioning of platelets, and so it could cause bleeding disorder. and it's one of the cause of bleeding disorder. It mostly occurs in CKD patients because they have increased blood urea levels, and so it becomes an indication for dialysis. And after that comes pruritus, fatigue, and anorexia. These are also symptoms of uremia. So and the conclusion is that you should remember this mnemonic AEIOU, and I tried my best to make it as simple as possible. And these would help you very much in your clinical vignettes. You will see multiple questions on that, and I hope my video will help you in solving those clinical vignettes. So thank you for your time. Don't forget to subscribe the channel. I thank you all.